Welcome to Inside Urgent Care, hosted by Dr. Cassandra Donnelly, the podcast that brings you real stories straight from the front lines of one of the most dynamic spaces in healthcare, urgent care. Whether you're in the field or just curious, this is your go-to spot for honest conversations, insider insights, and the voices of those who make it all happen. We're so glad you're here. Let's dive in.
Today in our Urgent Care podcast, I am delighted to kick off this inaugural podcast with myself as the host and having the pleasure of interviewing my friend and colleague in emergency medicine, Dr. Patrick O'Malley. I'm going to let Patrick introduce himself and all the accolades that go along with him. But I'm so grateful that he has agreed to help me kick off this next session of the Urgent Care podcast. So Patrick, why don't you introduce yourself? Tell us all about your career path into urgent care as you kind of launch us into who Patrick is.
Absolutely. Well, Cassandra, thank you so much for having me as the inaugural guest of this podcast. And I'm really excited to see what you are able to do with this and watch it grow and reach the ever expanding urgent care audience. So just briefly about me and how I ended up in the urgent care orbit. I'm residency trained in emergency medicine, and after residency I moved to South Carolina and spent 7 years working in a busy not inner city, but metropolitan area emergency department. And after 7 years, I think really the only way to describe it, looking back on it, was probably, quite honestly, some burnout. And it's something that a lot of us in the emergency medicine field are very familiar with. And fortunately, the hospital that I was working for had a network of urgent cares. And one of those they had struggled to find staffing for. And myself and several of my emergency physician colleagues were probably all in a very similar situation. We were like, you know what, this may be a good opportunity for us to, kind of get a second breath, catch our second wind. And we went out there, and it was really a remarkable opportunity for all of us, myself included, to kind of reboot and get reset and still work clinically, but just in a much different environment, in a different setting. And I really enjoyed the work that I was doing at urgent care. It was a high volume, high acuity. We saw, I think at that time, it was probably over 60,000 patients a year. We had a CT scan, we had ultrasound, MRI was available. It was kind of based at a surgery center owned by the hospital. But that was really my first foray into urgent care, and I really enjoyed it. And I think around that same time, I started going to some of the Urgent Care Association conferences, doing some consulting work for some medical device companies at the time. But that really was my main introduction to urgent care, and was really just taken aback by how kind, friendly, open, and welcoming that whole audience of urgent care folks was. So that was, I guess, where I really got my introduction into urgent care, was kind of just by chance, looking for respite from the emergency department.
Awesome. Thank you for that. Yeah, certainly many people come into urgent care from different places and spaces. And so it's always good to know that someone's story about how they entered, because someone else obviously could be looking for the same entryway, and hearing your story could be their pathway in. So you're emergency medicine trained, and tell us a little bit about a day in the life of your career, and what does it look like for you from emergency medicine, and even as that relates to how you could on any given day impact someone working in urgent care?
Yeah, that's a great question. And, thinking about this, even though I am, so I spent 3 years working exclusively in urgent care. And then there was something that was missing, and I really wanted to get back to my roots with emergency medicine. And there was a great opportunity that opened up in the small community hospital that I'm still working in. But all of the work that I did in urgent care as a clinician, but also kind of outside of that, really really just kind of sparked something where I wanted to be involved in the urgent care community. So now I do work exclusively in the emergency department. I'm winding my clinical career down so that I can focus more on some other outside projects, and education being one of those. So my typical work day, working in the emergency department, kind of a low acuity, high volume emergency department. But one thing that all the work that I've done in the urgent care space and with the urgent care community has just made me more mindful of some of the needs, the gaps in education. Sometimes with patients who get referred from an urgent care, it's opened my eyes to some of the things that could be done better in urgent care. And, several years ago, some of you may be familiar with the work that I do with EB medicine in an educational perspective, or an educational role. But several years ago, I came up with the idea to create this laceration course because I did see a lot of patients who were being referred from urgent care. And that's kind of my main area of clinical interest. I've always enjoyed lacerations, and I saw that there were so many people in the urgent care community who did not have the same degree of comfort and the degree of confidence and the exposure to laceration management that many of us get in our residency training, especially in emergency medicine. So after I started playing around with this idea for a course, I had connected with Dr. Tracy Davidoff, and she asked me to become more involved in the Urgent Care Association through the College of Urgent Care Medicine. And, looking back, I would have had no idea how much of an impact that would make on me personally and professionally. But being welcomed into this new community really has been just beyond rewarding from both a personal and a professional perspective. So, having conversations with urgent care leaders and seeing that there were some specific deficits in knowledge really helped guide the development of the laceration course. So even though I'm not working in urgent care per se, I'm not clocking in and clocking out and seeing patients in urgent care, I still have a very strong affinity for those who are working in urgent care and the patient population that utilizes urgent care. And really just enjoy the educational aspects and, knowing that people who have gone through my course, the work that I do with EB medicine, the impact that we're making, it's been a lot of fun. It's been probably the highlight of my professional career was having this involvement in the Urgent Care Association and meeting so many just wonderful, passionate people. You and I were talking earlier, and I kind of equate urgent care to how emergency medicine was 40 years ago. It was kind of a hodgepodge of clinicians, whether it was general surgeons, internal medicine, and pediatric, practitioners who came together and just said, we don't want to work in the traditional surgery, internal medicine, family medicine, pediatric roles, but we really kind of like this thing called the emergency department. I think that there's been a very similar evolution with urgent care. It's family medicine docs, it's emergency physicians, it's, a multitude of PAs and nurse practitioners who didn't really like either working in the emergency department or working in a clinic or in the office 9 to 5 type setting. And they like a little bit more adrenaline, a little bit more spontaneity and the creativity that urgent care allows for. So I really see a lot of similar parallels between emergency medicine and urgent care. And it's really just a lot of fun to be part of that community and being actively involved in the organizations.
I completely agree. I definitely see a lot of similarities in emergency medicine and urgent care as well, starting with the introduction of emergency medicine and urgent care, and certainly just in terms of the folks that are drawn to each of those specialties.
Mm-hmm. And it does. It takes a very special person, to be able to see the volume of patients that we see in the urgent care setting with limited resources, limited time, and the demands of, documentation, patient satisfaction, and all of those things. It really does take a special person to work in that environment. And I think that's, another important thing, with the Urgent Care Association and the advocacy work that they do is so important. advocating for better access, for improved reimbursement, and all the legislative work that the advocacy committee does. It's really just a remarkable organization, group of people who are working all these things, and I think it's also important to get more and more people involved in that. It doesn't take a lot to do something that's very impactful. I think we've talked about that. And you came up for the Urgent Care Association Day that we did in South Carolina, and it was a wonderful event last year. And really just trying to encourage people to get involved on a local level, make connections with their local state representatives, go and be the doctor, the clinician of the day at your local state house and whatnot. So really a lot of opportunities for people to get involved, and it doesn't require that much work.
Completely agree. So tell us, what's the most challenging part of your day?
For me in particular, working in the emergency department, the older I get, I struggle with the multitasking that's involved with, managing 5, 6, 7, sometimes upwards of 10 patients at one time. I think the multitasking and the constant interruptions is just something that I struggle with more as I get older. The noise, just the kind of the controlled chaos that the emergency department and the urgent care setting fosters. That has become harder for me to deal with as I've gotten older and more gray hairs popping up on my head.
Gotcha. Yeah, that's something that most of the folks that go into urgent care that they thrive on initially. So it's interesting that, after some time, that would be something that kind of is a little bit more grating, but it's good to know for those folks who are, having some thoughts and considering. So
yeah, it is. I think it's a skill set. And, in our residency training, that's something that we learn how to do. You learn how to multitask, you learn how to tune things out and really stay focused. So it's kind of interesting. It's one of the things that brings us into this line of work or these specialties, urgent care medicine or emergency medicine, is, at least for me, I can't speak for everybody else, but I think it's one of the things that is starting to take a toll, is leading me towards a somewhat of a career transition here in a couple months. So I'll be leaving the emergency department to focus on the educational work that I do with EB medicine and the laceration course.
Gotcha. And then the flip side of that is, what's the most rewarding part of your job?
Yeah, the most rewarding part, I would say, my position may be a little bit different than others. And I think there's two main things that really drive me and keep me motivated and give me chill bumps. And there's two things. One, it's when I do have on the, somewhat of a rare occasion in the emergency department setting, but it's when you make a meaningful connection with somebody, when you can actually sit down, catch your breath, and actually talk to somebody, put your hand on their leg, give them a sense of understanding that they're being heard. And I've said this in several other podcasts and interviews that I've done, but being able to give a patient a hug is, I think, just the most rewarding thing, because in the emergency department, even in the urgent care setting, it's not something that's expected. And I think when we're able to make a truly meaningful connection with somebody, giving them a hug, reassuring them that it's going to be okay and that we're doing everything to hear them and to be there and to advocate for them, I think it's an honor to be able to do that. And it's just a very special thing. And then with the other work that I do with education, for me, when I hear from somebody who has gone through the laceration course and they now have confidence to do something that they previously did not have the confidence to do, is incredibly rewarding. It's the same kind of chill bump sensation, that I get when I make a meaningful connection at work with a patient. But hearing from people, because there is nothing more uncomfortable, I think, in our line of work than doing a procedure that you do not feel comfortable with. That is not a fun position to be in. So knowing that I've created something and am committed to creating something that gives my colleagues, my clinician colleagues, the comfort level and the confidence to be able to do something is incredibly rewarding.
For sure. Well said. I could not agree with you more on that one, certainly as it relates to giving a patient a peace of mind that you took some time out of everything that's going on to connect with them, which
Mhm.
is something that they probably wouldn't expect from a physician. I think is so important and likely something that that patient will take with them for the rest of their lives. They will tell that story over and over to people who may not have thought that it would happen as well. So tell us what advice you would give somebody considering a career change into urgent care, or for that matter, a career change from emergency medicine, something that they've been doing, and they're thinking about urgent care. Is it for me? Is it not for me? What advice would you give them looking forward?
That's a great question. I think that there's this feeling or a sentiment that it's just urgent care. And I think that that's an unfortunate mindset to go into it. Urgent care is its own evolving entity, its own specialty. That's something that many within the Urgent Care Association, the College of Urgent Care Medicine, and the Urgent Care College of Physicians are working for, is to get a seat at the table within the House of Medicine and to be designated as its own specialty, because it is a unique environment in which to work. An emergency physician going into urgent care is going to be, their feathers are going to be ruffled because you don't have the consultants. You don't have advanced imaging. You don't have the entire complement of laboratory tests that you can rely on. So your clinical decision making has to shift to one of less resources, less consultants, and oftentimes in a much more pressured environment because of the number of patients that you're going to be seeing. And the same goes for family medicine. People who have been trained in family medicine. You go in and you see a patient, you come out and you've got 5 new people who have just checked in. You don't have 30 minutes per patient. You may have 5 or 6 minutes per patient. So it's a much different environment than working in a 9 to 5 office type setting. It's got its own inherent struggles, and I would just encourage people who are considering making a shift from a different specialty into urgent care to connect with some people. Reach out to some of the local urgent care groups, perhaps talk to some of the medical directors. Go in, take a look around, maybe shadow a shift or something like that. For our PA and nurse practitioner colleagues, urgent care is now 85% run by APPs. And there's been a dramatic shift from physician run to now APP run. So I would say, talk to your colleagues, talk to your friends. There's a large number of Facebook groups that are dedicated to urgent care medicine. But get involved, get feedback. Don't do it because you think that it's going to be easy, because it sure as heck is not. The volume can be stifling. Especially if you're working 12-hour shifts, seeing 40 to 50 people in a shift, it can be exhausting. So I think that coming into it with the right mindset, talking with people to get a good understanding of what you're going to be walking into. But I think that urgent care medicine really has tapped into something very special and filling such a huge need within our healthcare system. Myself and Dr. Raj Garia had written an article for the Journal of Urgent Care Medicine, a day without urgent care. And just imagine how our healthcare system would literally collapse if we did not have urgent care. So I think that if you are interested in getting into urgent care medicine, it's ripe for the opportunity for you to get involved and have a very meaningful career. But I think it definitely does require a special skill set. So just do your research, talk to people, and make sure that it's a decision that's right for you. But it
I
can be
love it.
incredibly rewarding.
I love it. Urgent care is definitely ripe for the taking, but do
Mhm.
your research because it does not come automatically. It will not be necessary. You have to be intentional
Mhm.
about your choice for urgent care.
Yeah. And if somebody who's coming in new, I think that also, brushing up on your procedures. There's going to be a lot of things that you're going to have to do. So it definitely does require some work on your end just to be familiar with, the different pathophysiology states that come in, the different conditions that are coming in, and the common procedures that you're going to be doing, because that's definitely going to be a shift if you've been working in the outpatient setting, coming into urgent care and having to reduce fractures, simple dislocations, being able to do pelvic exams, ear, eye, nose, and throat exams and things like that, abscess, lacerations. You got to be familiar with that stuff.
For sure. All right. Well, any parting words for us as we leave this inaugural session?
Well, with this inaugural session, then I think I have to give a shout out to the urgent care organization and all the regional urgent care organizations that are present. We've got Caluca on the West Coast, Naruka in the Northeast Regional Urgent Care Association, and Suruka, which is the Southeast. And if anybody is listening to this, I would really encourage you, if you're already working in urgent care, to really get involved with those regional and the national organizations, attend the conferences, log into the webinars that are available for free. All of these organizations provide so much free, valuable resources. But just get involved. Don't be an innocent bystander. Get involved and really take the reins and be an active member to shape the future of the specialty.
I love it. Well, that's all the time we have for this session. Thank you so much, friend, colleague, Dr. O'Malley.
Yes.
We will talk soon.
Absolutely. Thank you.
You got it.
That's a wrap for this episode of Inside Urgent Care, hosted by Dr. Cassandra Donnelly. Thanks for tuning in and spending time with us. If you enjoyed the conversation, be sure to follow, rate, and share the podcast. Until next time, thanks for listening.